talk today. We're looking at collaboration with orthopaedic nurses in Myanmar. My name is Paul McLeish. I'm presenting tonight, and I recently travelled to Myanmar to meet with some orthopaedic nurses there on behalf of SAON, South Australian Orthopaedic Nurses Association. We've developed a link with orthopaedic nurses from Myanmar over the last few years after a number of them visited Adelaide, University of Adelaide and University of South Australia in a fellowship program provided by the Australian government. We also provided support for 3 nurses, orthopaedic nurses from Myanmar, to attend the ANZONA conference in Sydney in 2015 as well. So this was really my return trip to return the favour, I guess, and then also start developing some more actual plans and ways that we can work together as groups. So if you're not really sure, Myanmar is found in Southeast Asia. It's the area circled there. Quite a large country, bordered by Thailand, Laos, China, I think Bangladesh from memory. So it stretches quite a long way. You can see Singapore's around here, Hong Kong's just up here, so it's around that region there. It's made up of, obviously, of a whole range of different areas, but probably some of the main cities are Yangon, or what used to be called Rangoon, and Mandalay, which is a little bit further in the north. Myanmar is also known as Burma, so it's recently changed, well, relatively recently changed its name, but some locals still use the term Burma as well. It's quite a lot of seafront, lots of lakes and rivers, and then in the east and some parts of the north can be really quite mountainous as well. There's about 50 million people who live in Myanmar, lots and lots of different races, 135, and over 100 languages and dialects. But majority of the population are Buddhists, but others Christian, Muslims, Hindus, etc. as well. That's just one example of the one area in Myanmar where the ladies wear the rings around the neck to stretch their necks out, and that's also seen in some parts of Africa as well. The healthcare system in Myanmar is basically mainly government-run service, and that's the main source of funding. Generally, it was free until in the 1990s, and there's started having some cost sharing around then as well. Having said that, the amount of resources provided towards healthcare in Myanmar in those days was very, very limited. So the healthcare system was pretty small and relatively ineffective, I guess. And that was really related to the political climate, and Myanmar was basically run as a military state for a long time and very closed to outside organisations and any sort of collaboration. But obviously that's starting to change in the last sort of 5 years or so. There's been some democratically elected governments, which were sort of not too bad in terms of representing the people's will, but that's really changed last year with a fully free election and that elected Aung San Suu Kyi, who's been the long-term sort of leader for change in Myanmar as well. So big influence on healthcare, and over the last few years there's been a significant increase in the resources provided to the healthcare system, which is having some really big changes and positive effects as well. There are some traditional medicine still, so that can always be interesting with some of the belief practices of some of the public and some patients as well. So like I said, underfunded for a long time. It's gradually increasing and significantly, especially in the last 3 or 4 years as well. The budget has quadrupled, but still suffers from some lack of resources and supplies as well. But you can see the difference in the expenditure. So in 2002-1, it was 7,600 million kyats, it's just the local currency, and that's increased to 652,000 million. So you can see the significant increase there as well. There's been a long history of people from other countries visiting Myanmar and working together in collaboration. Obviously, that's been relatively limited in the past, but in terms of orthopaedics, there's been a number of people visiting for quite some time, and you can see some examples there as well. Some British doctors. And a number of other countries, French as well. So sort of a succession of different surgeons. So really that collaboration and those visits were really focused around orthopaedic surgical technique. And that's had a lot of benefits for the country. There's now a greater number of orthopaedically trained surgeons, and they're starting to be able to perform more types of surgery and attend to more a high level of variety of different specialties in orthopaedics as well, which is great for the people. So that's starting to become more widespread, and especially that's part of why we wanted to create some collaboration as well in terms of orthopaedic nursing as well. So initially there was a really limited number of specialty doctors. That's gradually changing. That's having a big impact. A lot of the time the nurses that visited were really from the orthopaedic operating room nurses. You can see example there from Paris. I won't try and say the name of that hospital, but that's been a long-term thing, but really hasn't been a lot in terms of the ward orthopaedic nurses, and that's part of what we're trying to address with this collaboration now as well. So ortho nursing care in Myanmar, so there's both specialised and I must say a lot of these slides, sorry I should have said this at the start, are from three of the nurses who visited Australia earlier as well, so I'm borrowing some of their slides, so I must acknowledge that as well. So number of specialised and general nurses that provide care to orthopaedic patients. There are a number of specialised orthopaedic hospitals in some of the larger cities as well, and they provide care just for orthopaedic patients, and they're increasing in size and bed numbers as well. Nurses generally do all the nursing care autonomously. Most of the orthopaedic patient care is carried according to the doctor's orders. The patient ratios can be really quite high, 1 to 10 in the morning and evening shifts and 1 to 30 at night. Now, having said that, it's like a lot of Asian countries, the family do a lot of the basic care in terms of washing, etc. So that's really not the nurse's role. It's focus on the other elements as well. The base degree in Myanmar at the moment is a diploma, and there are some people that have a bachelor, and there's starting to be a few more nurses that are getting specialty training as well. We'll go through that in a sec. So pre-1999, the hospital-based certificates for orthopaedic nursing were in existence. The orthopaedic specialty nursing program, which is a 9-month diploma course, is starting to become quite popular now. There's the two of the universities, probably the main ones that are focusing on this, are the University of Nursing in Yangon and Mandalay, and you can see the differences in the time frames there. So the Mandalay one's relatively new, but the really good news is that both of the universities now have a Master of Specialty Nursing in Orthopaedics, and that started in December 2014, and there are increasing number of people going through that, which is really great, I think, for the local practice. So we'll go through pretty much from now on some pictures that I took while I was there only last week. So this is in Yangon. This is the airport. So there's quite a lot of newer buildings and really quite good facilities, and then there's some really old and challenging facilities as well. So you can see inside the airport, this is the domestic terminal. It's really this old traditional wood style that looks really great. It's amazing quality work. And then next to it is the international one, which is completely new, very almost sterile, but really quite nice new airport. So lots of variety there as well. So you can see some of the conditions. So these are just pictures I've taken along the road. So often things like footpaths and roads aren't in good condition. The electricity supply, you can see up the top here, is like a lot of developing countries, is pretty messy, and would be a nightmare trying to fix that, I can imagine. And also, if you've been to anywhere in Asia, you'll know that the the traffic is a lot different. There's there's lanes, but that's mainly really a suggestion, and it's just there's a whole different system to maybe what we're used to in places like Australia as well. Part of the reason why I've taken so many photos of the traffic is, I guess, is in places like Australia, orthopaedic nursing's maybe shrinking a little bit. There's not quite as much of a specialty as it maybe once was, maybe 20 years ago. But in places like Myanmar, it's becoming, well, it is, and it's growing, I guess, in terms of the numbers of people injured and the number of orthopaedic patients that there are. And one of the big reasons for that is road trauma. So car accidents, pedestrian versus car, MBAs, and so things like, you can see this guy, a lot of these people who ride around the roads will ride down the middle of the road, and you could just imagine there'll be times where they'll just get cleaned up by cars. There's also a lot of people that will walk, try and cross the road, so there might be 4 lanes of traffic, and they will, and constant traffic, no real brakes, and they will just stand in a lane and wait for a break, if they can run past and get across to the other side. And given that there's really no adherence to lanes in some areas, that can be, I can imagine there'll be a lot of pedestrian versus car injuries as well. So you can see a picture up here of this guy. He's just going around selling flowers, which are like a little good luck thing that you hang on your rear vision mirror in your car. So there's those sorts of injuries. Then there's things like this truck, which is obviously loaded way up to the top, and then a lot of you see a lot of guys sitting at the top of the trucks, and they get pretty close to the power lines and to the trees as they go past as well. And then things like here on the right, you see people sort of hanging off the back of trucks, and you can imagine going over a bump or stopping suddenly, that could cause people to fall off and get injured as well. They drive on the right-hand side of the road in Myanmar, but a lot of the cars, or pretty much all of the cars, and a hefty number of the buses are all are all right-hand drive. And what that means is the doors of buses are on the outside. So for people to get on the bus, they need to leave the side of the road, walk around into this traffic lane and get on the bus, and vice versa when they get off as well. So I can imagine that would lead to incidents where people get hit by cars as they're travelling past, while people are trying to get in on and off the buses as well. So I'm not sure exactly why all the cars are right-hand drive. On the right-hand side of the road, your cars are left-hand drive, but that's just the way it's developed, I guess, over time. So those interesting things. Some of the roads can be a bit cruddy. This is one of the main roads leading up into the hills from Mandalay, and sometimes these big trucks. This one's on the side of the road, so it's not too bad. But there was a number of times we'd come around the corner, there'd be just one broken down right in the middle of the road, and it meant you had to sort of squeeze past it on one side, and there was a big drop down the edge. So I can imagine there'd be lots of incidents where people get into grief there and sustain injuries as well. Some of these roads are quite good, but then some of these areas, especially around the corners, they'll be really bumpy, unstable roads, and in the big rains, that would be a significant problem as well. So people lose control and end up crashing off the road, end up with orthopaedic trauma as well. There was a place in Yangon that had some traditional houses, and this is sort of like a really old style house, and it was sort of quite interesting, made out of blackened bamboo. This is the University of Yangon, so this is the nursing part, so there's a lot of lectures and stuff happen here. Reasonably newish buildings. Some areas are air conditioned, some areas are opened. So it's a little bit different, but for myself coming from Adelaide, where it was 6 degrees at night, it was a bit challenging to be there when it was 37 and 98% humidity. So it takes a bit of getting used to. This is a group I did a presentation to. So these are orthopaedic nurses who are doing the 9-month course, but the ones at the front with the green. So these two ladies here, they're master's students. So often the colour of the skirt tells you what their position is in terms of study and also work as well. We've got the two ladies at the front opposite me are also the nurses, two of the nurses that attended the conference in ANZONA in 2015. This is the picture down the bottom is me in front of another part of the School of Nursing or the university as well. Now, this is one of the labs in that building that I was just showing you before. This is really quite an up-to-date, this is probably one of the best facilities I saw in Myanmar the whole time I was there. You can look at the barishes, they're really quite new sort of things that we're used to in Australia. A lot of other facilities had very old, nowhere near that level of newness or complexity in their skills labs as well. So this one was really quite good, but they still, struggle a little bit for resources and other things. So when they do casting, that they only use plaster of Paris because they don't have access to any synthetic casting materials. So yeah, just little things like that they tend to struggle with. This is one of the orthopaedic hospitals in Yangon. So this is the outpatient department, and we just get there and there's hundreds of people sitting around in chairs just waiting for their turn to be seen, and doing it quite patiently really as well. And so you can see this is the front entrance here. You can see this ramp. This is a really steep ramp. So you imagine trying to push someone up there in a wheelchair and not have them fall out. It would be quite challenging as well. So buildings, lots of variety in terms of the quality of building. This building's quite a lot older. You can see some, it's quite damp and dirty in some places, but the ward areas they try and keep really clean, but all the ward areas are basically open. There's no air conditioning, it's open to the outside, there's just bars on the windows, and it's very basic facilities as well. This picture on the bottom left, this is a nurse's station in that hospital, so you can see there's lots of storage, and everything's obviously paper based. And the nurses wear the hats, of course, and there'll be ones that have little stripes across there, and they're the student nurses as well. So every time I wandered into a new part of the hospital, there'd suddenly be 20 nurses appear, and they'd all stand there, and I felt like a bit of a fish out of water. It was quite funny. Now I didn't take any pictures with patients in there. I just didn't want to have them in pictures, but this is some beds in one of those wards, so you can see it's a pretty basic setup. These beds are not adjustable in any way, so if they need to be tilted, the wheels get put on bricks down the end or the other end if you need to. Notice there's no oxygen suction. There's some power outlets, probably one or two for 3 beds there, and that's about it really. The thing on the end, the bags on the end have the x-rays, and I think sometimes they put notes in there as well. You'll notice how close the beds are together, so there's very little space in between. There's some basic storage there as well. So really no lifting equipment there, and that's probably part of the reason they have them so close, I guess. And the mattresses, these ones aren't too bad. Some of the ones I saw in some of the other hospitals really quite thin and getting a bit old as well. This is right next to that hospital. This is a brand new building that was only, I think, a year or a year and a half old. So this is enclosed, air conditioned, and very, very new and really good quality building. So you can see the beds in there down the bottom are a bit of the newer beds. They have a bit more ability to be adjusted. The floors are sealed. It's obviously enclosed and air conditioned and much better quality. This is for spinal patients, and this was created in conjunction with the government and a private donations from a number of different people as well. So this is this sort of quality of facilities starting to be found in the country, and probably mainly in the main cities as well, in Myanmar as well. So this is Mandalay. So if anyone knows the song "Road to Mandalay," this is it. If you're a bit older, you'll probably know that. Along the way, though, so this is a really fancy road for there, so really nice and big, but still quite bumpy. You probably can't do more than 80 k's an hour, otherwise it gets a bit too out of control. And there's still sheep They have some cows wandering along there, trying to dodge the buses and stuff like that as well. Some of this other, so in Mandalay, there's a lot more motorbikes than in Yangon, so there's lots of people riding around, often two people sitting on a bike. The lady sits side saddle, and I've saw a number of bikes with maybe two parents with 2 or 3 children on that as well, and some kids, like babies being held just with no restraints at all. So you can imagine, just hitting a hole or falling off that bike would lead to all sorts of injuries. Majority of people don't wear helmets, but there's probably more than I expected to do, actually, so it's surprising. So this guy here's got a helmet on, but he was riding along having a chat on his mobile, trying to dodge all the other traffic as well. And again, another picture here, this truck really overloaded and some guy just sitting on the top there, having a nice time with the wind in his hair. This is leading out of Mandalay up and towards the hills. So this road was quite good as well. It was sort of treated as a 2-lane road, but you sort of dodged, drove past the trucks when you got a chance. And again, lots of guys sitting up on the tops of trucks trying to dodge the tree branches as they come along as well. This is the university again in Mandalay. So this is probably a relatively new building and mostly air conditioned. So pretty good facilities. There was a big lecture theatre in there, and this is where I presented to nurses from there. So quite a big gathering of people. You see the different rows, and it's a little bit like an aeroplane. The front's first class, and then there's business and premium economy, and then economy. It's something that we're not really used to. You sit depending on what your position is, I guess. So it's something that I'm not really used to, but it's obviously pretty common over there. This is the library in Mandalay. So this is their library. A lot of old books. They really don't have access to lots of the latest literature. So I managed to take over a number of books from my university, the University of Adelaide, but they really do need access to more contemporary literature, because some of these books are 20, 30 years old. They do have some e-books, access to those as well, but they also struggle to access stuff online, so that's a challenge for them as well. This is out, you can see all the bags lined up here. The nurses were having an exam, so they put all their bags out here, and this is just one of the courtyards around the university as well. This is a hospital in Mandalay. So this is an orthopaedic hospital, so relatively new, pretty good facilities, but again, all the wards are open, no air conditioning in most of the wards except for ICU and theatres as well. This is the front entrance. A lot of people would turn up in these sorts of structures if they were transferred from somewhere else, and then they got, again, wheeled up a pretty steep ramp to get into the hospital. And when I say, if it's on a barouche, it was a pretty old rickety metal frame barouche. So it's set up in like a square shape with a big green area in the middle. Very hot and very humid there. Like you can see in this picture down the bottom, there are some air conditioning, and this is the theatre section. So that section is air conditioned, which is, I guess, good when you're going in there and you're dressed up all day in your scrubs. But again, the main, pretty much all the wards otherwise are all open, and no air conditioning as well. Now, this is an example of some of the equipment they're using. This thing is probably from, I hate to think, maybe the 50s or something, even earlier. They'd said they don't really use this for traction anymore, and this, I've never seen this before, but you can see there's 3 little pulleys, so one there, one up the top there. And I guess in the past you could run strings and maybe Thomas Splint or something in line with those, I guess. I'm not really sure. But they said that they really only use this. Sorry, you can see another pulley down there. Really only use this for alignment now. So it's a little bit like a Thomas Splint. You can sort of see the edges come down there as well. So I guess that's what the function is. And potentially you could run some traction off the end of that as well. But what they do tend to use now for traction is this. So this patient's in traction. This blue bar here is just a bit of like PVC. There's a bandage around this man's leg, and then there's this strap that goes around this leg. So it's only strapped on by that small amount. That's then attached to a cord, which you can see coming out over that blue bar and then hanging over the edge. So there's a reasonable amount of friction there, I guess, but that's all that they've got. And they've got a couple bags and just plastic bags with stuff in it that keeps his leg elevated. You can also see down the bottom there, they've got the bed tilted up on bricks, and that's to provide some counter traction. Some of these beds are pretty basic beds. They don't do anything in terms of movement, and so that's why they need the bricks. Some of the ones in this hospital had the wheels on the bottom, and they didn't have brakes, so they again put them on bricks with the bricks with the sort of the lowered area in the middle, so the wheels sat in the lowered area and didn't move around, so the bed was relatively stable the whole time as well. But you can see generally, there's some of the floors, because it's all open, it's really hard to keep really clean, and obviously infection's a big issue in some areas. Now this is the ICU. There was 4 beds in their ICU, so this is pretty a lot different to some of the other areas. Enclosed, air conditioned, really good hygiene practices. You can see up the top here there's a lot of power outlets. There is some oxygen and suction as well, and they had over in this bed over here, they had a lady who was ventilated with a tracheostomy as well. So and they all got all the monitors and the relatively up to date ventilators as well. So not too bad. Some of the mattresses they had were pressure reducing mattresses as well, as opposed to these ones, which you can't really see here. Maybe on the previous one, no, there's really probably maybe 2.5, 3 centimeters thick of just old foam, so they're quite a lot different. But these beds are much fancier. They're a bit more wind up and a bit more ability to change them around to the needs as well. Given all these challenges and lack of resources, the people there are really, really friendly, really kind. They're very, very generous with what little they have, and they're very motivated to providing their patients with the best care possible as well. So they're as keen as mustard to get a hold of new information, to get hold of resources, to have help from other people, and I guess that's part of what we're trying to do as a group as well. So these are just some examples. Every time you go for a meal, you order 1 plate of food, but there's all these other extra things that come out, and so there's some poor bugger who at the end of this meal has to wash 30 plates of different stuff as well. And so it's really really supportive, and they're really keen for that sort of having that dialogue and that relationship with other groups as well. This is just an example. We went out for the day in New Mandalay. You can see a lot of the leftovers from the really big spending on the military. Some of these military bases had huge, enormous gates with very, very long, very good quality roads, and you can just tell that a lot of resources were diverted to those in the past as well, and that's slowly starting to change. Lots of really pretty places as well. This is a waterfall up in the mountains outside Mandalay. There's a big moat here that goes around a palace in the middle of Mandalay, and it goes around on all 4 sides in a square shape, and every side is 2 miles long, so it's an absolutely enormous place. This is up in the mountains of Mandalay, and just really nice sort of tropical rainforest areas there as well. This is also up in that area, some really nice manicured gardens. They have a flower festival in this place every year, and it's really quite pretty and amazing. Then we got onto some of the really small dirt roads leading off to some of the other areas in the country. So, doesn't look like there's much room there for 2 cars to pass, but they seem to manage somehow, and it's a pretty regular occurrence in some of those roads. This bottom one is a vineyard that we visited, and you can go and pick your own grapes. And more pictures of family and friends, and it's just really good to spend some time with these people as well. And very proud and very passionate people as well. This is a scan. This is a document that they gave me of one of their hospitals. This is the hospital in Mandalay, and they, as best they can, they do have relatively good data collection on some of the basic stuff, but probably some of the more complex stuff that they struggle with to get good data and record that as well. But you can see, for example, the our OPD. So the top here. Just get my little drawer out. So OPD in 2012 was about 17,000. It's now gone up to 35,000. So just in the space of those 3 or 4 years, that's increased significantly. So that shows you the extra resources that are going into these areas now by the government, which is absolutely great. The problem with that, though, is increasing beds, increasing hospital sizes, which is what they're doing, is they therefore need nurses to be able to provide that care as well. So that's obviously an issue as well. The length of stay is quite long. So you can see, where's the length of stay? Sort of 14 to 20 days per patient. And that's obvious because for a number of reasons. So they struggle to get patients to theatre early on admission, and that's really related to the lack of number of surgeons and also theatre space as well. So that really puts a delay on length of stay. So often patients are waiting for a week for surgery, and that has a big impact. So, and obviously that would have a big impact on their adverse events as well. It's obvious in the literature that that's a problem, especially for patients with fragility fractures and hip fractures, etc. as well. The other issue is lack of support for community services. So, we're blessed in Australia the ability to, even though sometimes we might not think it, but at least get some services in to support people on discharge so we can get them out of hospital early, and that's just not the case in some of these places. It makes it a lot more tricky as well. One of the things you can see over here on the right is the number of specialties that are starting to occur now. So you can see in 2015 there's a number of specialties that weren't there before. So things like pediatrics, foot, ankle, reconstructive, sports, oncology, they were just never really a specialty before, and that's telling that there's a number of surgeons that are starting to specialise in those fields, and which is really great for those patients. So that's gradually starting to get better and better as well. Okay, that says thank you in Burmese. I've led to believe. This picture is this is actually not something they use now. This is an old thing that they had just lying around, which was I thought was really interesting. It had the principles of treatment of a simple or closed fracture, which was to the point and quite succinct, and I like it, and said, reduce the fracture or keep it immobilised and then rehabilitate the patient. You can't go too wrong if you go by those principles. So I thought I quite like that as well. And that was just sitting in the head of the hospital's office, something that they obviously had used many, many years ago as well. So that's my presentation. Thank you for listening. If you have any questions, feel free to contact me on that, but I do encourage people to get involved in this sorts of activity. If you're interested, having people go over there, take equipment, do presentations, just discuss different ways of managing orthopedic patients is a really valuable thing. So I highly recommend that to you. And then also, if in your local group, if there's another setting or country that you're interested, you can do that as well. So thank you all, and until next time, thank you.